Uniform Medical Plan is ready to meet your healthcare needs with several plan options to choose from. Medical benefits are administered by Regence Blue Shield, which means you'll have access to a large network of providers in Washington, one of the largest networks of providers across the country, and access to network providers around the world when traveling. Your prescription drug benefits are administered by ArrayRx. With access to thousands of network pharmacies across the country, it's easy to fill a prescription or get a covered vaccination near you. Convenient mail order options to fill prescription drugs are also available. With a UMP health plan, you pay $0 for covered preventive services like annual checkups and certain screenings and vaccines. You'll also have comprehensive benefits for covered services such as emergency care, hospitalizations, lab work, office visits, and more. That includes being able to get an annual checkup or routine care from the comfort of home. With doctor-on-demand virtual primary care, you can have a video visit with a high-quality primary care provider on your phone, tablet, or computer. For behavioral health needs, you have a variety of options, including in-person and virtual visits with a diverse range of specialists. Access to a care management team, including behavioral health specialists for one-on-one support, and digital self-guided tools to strengthen your emotional health on your own terms. Be sure to show your UMP member ID card when you visit a doctor or fill a prescription. On the back, you'll find the number to call UMP customer service about medical coverage and contact information for ArrayRx for your prescription drug needs. To get the most out of your benefits, create an account at ump.regence.com or download the Regence app. Every time you sign into your account, you'll see personalized information based on your benefits. You can easily search for providers in your network, estimate costs, track claims and benefits, chat with customer service, schedule virtual care visits, and access your Smart Health Wellness program. And you'll find ways to improve your health through care programs for maternity support, managing diabetes, or tobacco cessation. The pregnancy program brings support to parents at every step, with access to a 24/7 nurse line and a personalized app for tracking their baby's milestones. For extra support managing diabetes, you'll have access to glucose tracking, live coaching, and mental and emotional care. And with our smoking cessation program, you have support from a dedicated care team, unlimited one-to-one coaching, personalized mobile content, and nicotine replacement therapy. When you sign into your personalized online account, you can access helpful drug resources from ArrayRx. You can choose between 3 UMP health plans. Let's explore a few scenarios to help you compare plan options before we compare costs across all plans. Our first employee shopper is single with few healthcare needs. The UMP Achieve One plan is a good fit, with its lower monthly premium and $750 annual deductible for individual coverage. The $125 wellness incentive, if earned in the previous plan year, lowers the deductible to $625. Eligible subscribers can earn the incentive by completing the Smart Health Wellbeing Assessment and tracking healthy activities. Let's look at the next plan, UMP Achieve 2, with an employee who has a growing family. A second child is expected soon. The UMP Achieve 2 plan has a higher premium than the other plan options, but offers a lower annual deductible, which is $750 for a family and only $625 with the Smart Health Wellness incentive, if earned during the previous plan year. That appeals to our shopper, whose family will need a lot of care in the coming year. Now, let's look at what's unique about the UMP High Deductible Plus Health Savings Account plan. This lower premium high deductible plan is paired with a Tax Advantage Health Savings Account, or HSA. The employee can contribute pre-tax dollars to their HSA and use their account's debit card to pay for qualified services not typically covered by insurance, like LASIK. Subscribers age 55 or older can contribute up to $1,000 more per year. Unspent funds roll over year to year and are available for use even after retirement. Their employer will also contribute to the employee's HSA, which can help pay the deductible for qualified healthcare expenses. The $125 Smart Health Wellness Incentive, if earned in the prior year, will also be deposited into the employee's HSA. Here's a side-by-side comparison of your monthly premiums for each plan option. Here's a look at the medical deductibles for each plan. That's the fixed dollar amount you must pay each calendar year for covered services before the plan starts paying. For the Achieve 1 and Achieve 2 plans, your deductible will be lower if you earned the $125 Smart Health Wellness Incentive the prior year. After you meet your deductible, co-insurance is the percentage of the allowed amount you must pay the provider or pharmacy on claims or prescription drugs where the plan pays less than 100% of the allowed amount. The allowed amount is the most the plan will pay for a covered service. Here's a look at the co-insurance for each plan. Now, let's look at the out-of-pocket limits for each plan. This is the most you pay during a calendar year for covered medical services when you see preferred providers before the plan pays 100% of the allowed amount. Prescription deductibles are unique across each plan. You'll notice that the UMP Achieve 1 and Achieve 2 plans are the only ones that have annual deductibles for prescription medications. Here's the prescription drug co-insurance amount you'll pay if you choose the UMP Achieve 1 or Achieve 2 plans using a network pharmacy. Co-insurance is determined by the drug's tier. For value tier and tier 1 prescription drugs, the deductible is waived. Now, let's look at the prescription out-of-pocket limits for each plan. This is the most you pay during a calendar year for covered prescription drugs and products when you use a network pharmacy. Here's a complete view of all the costs for easy reference. Ready to learn more about the UMP health plan options? Check out these videos or go to ump.regents.com/SEBB.